Alright, sounds good.
Yay!
I was expecting worse. It's really like not that bad. Good morning, everyone. It is Thursday. It is raining. I feel like last time I vlogged it was also raining. If I look dead, it's because I am. I did not get a lot of sleep last night, but today I am getting laser hair removal. So yes, I did get laser hair removal that day. However, I decided not to include it in this video, and I also forgot to mention that I am getting Botox. Also today we're doing something that I've been pushing back for a little while, but I am getting my lip filler dissolved. I've had it done since 2017, and when I first got lip filler, it would go away really fast because I guess your body metabolizes it quite quickly because it's like a new thing that you're injecting. So I got it often, and it eventually built up, I guess, collagen, and since 2019 they haven't gone down. Like, this is what I had. So I did filler for 2 years, then the last time I did it was August 2019. But when I smile, I'll try to show you guys close-ups, there's like a white line, and I was told that it's filler migration. It's not like horrible, but I started really noticing it, especially in pictures with flash and everything, and it's just starting to bother me. And I am going to a fantastic clinic, Dermafina, and they will get it dissolved, and next week or in 2 weeks I will get them filled again. Lord help this face. So I am in my car, and I think you can already see all here and here that this is filler migration. You mostly see it on the top lip, so oh yeah, here definitely. So that is what we are getting dissolved today, and I am taking you guys with me and documenting the whole process. Are you Jasmine?
Yes, I'm
Hi,
Jasmine.
nice to meet you.
Nice to meet you. I can hold it.
Okay.
If you want. Yeah.
So we were just discussing the angles so we can document the procedure.
Absolutely.
And whenever you feel like it, you can zoom in and everything to show what he's doing.
Perfect. You know Karen, right?
Yeah, I do.
Yes, I always film her stuff.
Yeah,
and
yeah,
like when
I
you
saw
go
her.
like I can just get all the good angles.
Hi everyone, I am here with Dr. Shamout at Dermafina, a fantastic medical clinic. And I'm going to let you explain what we're going to do.
So hello everyone, my name is Dr. Shamout. I'm a dermatologist, board certified in the United States and Canada. Today we're going to be doing Botox for Hala's forehead, for her forehead line. So we're going to be injecting the frontalis at 1 centimeter apart. We'll see that we're going to map it afterwards. And after that we're going to be doing also the glabellar complex for the frown line. So we're going to be injecting the procerus as well as the corrugator supercilii. And she wants to also treat for prevention of the crow's feet. So that's going to treat the lateral aspect, which means the outside aspect of the orbicularis oculi muscle. And today she also requested an eyebrow lift. So we're going to be injecting the superior lateral aspect of the orbicularis oculi muscle, and that will actually give her a lift for her eyebrow. But to prevent it from being like a Star Trek character, like a Spock lift, we're going to give rescue injection to the top part of the frontalis to relax that muscle so it's not lifted too high. Do you have any questions regarding the Botox treatment?
Well, we had talked earlier, I wanted to know the difference with this sport. And there's also, I heard one called Xeomin.
Xeomin.
Yes, but today we are choosing Botox.
Today we're going to be using Botox. I've talked to a lot of my colleagues, and they really prefer, a lot of dermatologists, including Dr. Kraz, and they prefer this sport because this sport actually causes for them a flatter forehead because of the diffusion. It diffuses more than Botox, but the reason I'm using Botox today is because I don't want that diffusion into her upper eyelid causing a droopy eyelid, and Hala will not be my friend after that. So we're trying to prevent that for today. In terms of Xeomin, you could use Xeomin. In terms of diffusion, diffusion there's no really difference. It's a more pure molecule. Depends really on the patient's preference. But most of my experience so far has been with Botox. But I'm versatile. If you want to use Xeomin for this, we could use Xeomin.
Okay.
And the next step we're going to be doing. What do you want?
Most important.
So Hala has been going to multiple different dermatologists in the past, injecting her lips, but she's never had her lips dissolved. And I recommend for patients, if they're having multiple sessions for lips, at least every 2 to 3 times, after every 2 to 3 sessions, they should dissolve the lip because the patient is at risk for filler migration. So when I talk about filler migration, we normally want the filler to stay in the vermilion of the lip. But filler migration, when you start to fill a lip without dissolving, it starts to migrate to the cutaneous lip. And that's where you start to get the duck lips appearance. And also, you end up getting the corners of the lip becoming thinner because the lip filler migrates to this part aspect, pushing the lip corner down. So I describe it as cosmetic dermatology. Aesthetic dermatology is an art. And dissolving the lip is me really starting with a brand new canvas, a blank canvas, and drawing on the canvas. And patients' preferences of what they want, techniques they want, the look they want, that changes over years, over time. So when you dissolve your lip, you may have a different idea of what your lips you want them to look like, and then we can proceed with that. And we have a blank canvas.
Okay. Okay.
So first thing, I want you to look straight at me. So look at my finger. Do not look anywhere else. And we're really looking at where the white of the eye is and where it meets the iris, the color of the eye, and we're going to mark that as a point here, straight, and a point there. So this is really, the Botox is going to be between these 2 lines. Okay, we're not going to go farther out because really the frontalis and the forehead lines is focused here, but the most important thing is that we stay about 2 centimeters above the eyebrow because we don't want to cause basically brow ptosis. It's the eyebrow lowering down, not lid ptosis. Ptosis means drooping. So there's 2 forms of drooping. You can get drooping of the eyebrow and you get drooping of the eyelids. Okay, so the reason we stay up here is because we don't want drooping of the eyebrow. So can I get you to basically frown for me? Yeah, so here's the posterior. So we're gonna dot that there, frown again. And right here is the corrugator. It's a big muscle with the head and a tail. The corrugator needs two injections. Frown one more time. And the tail is right here. And the tail is right there. So that's basically it for the corrugator complex. And then for the crow's feet, I want you to smile. So we stay basically 2 centimeters outside from where the lateral canthus is. So 1, 2, here. That's the first injection point. And 1 centimeter above. And 1 centimeter down. The most important thing about this injection when you go down for the crow's feet is you don't want to go down to where the cheekbone is because there's a muscle that attaches to your lip. And if we inject that muscle, you're going to have an asymmetric lip. So one side's going to droop and the other side's going to go up and you're going to look a little bit funny, okay? And we'll do the other side. So smile for me. Final aspect, she wants the eyebrow lift. So we're going to do 2 injection points and this area is the safe zone. And that's it. Those are all the points we're going to be injecting today with Botox. And then I'm going to map out the forehead afterwards. There'll be multiple injections in the forehead. And then to rescue for her spot, we don't want her to have a spot brow, we're going to be putting 2 dots here. So I learned this from my colleague, Dr. Naif Al-Jihani, who is now in Saudi Arabia. He's a cosmetic fellow and he's one of the smartest dermatologists I know, and this is the method I would use. And we're not going to go on the dot because we don't want to put the ink in the chalk in the skin. And you don't need to go deep for this. So we're gonna give you 4 units. And here we go. Okay, frown again. So we'll do the left side first. So this is the head of the corrugator. This needs to be a deep injection. Okay, and then frown one more time. Okay, that's the tail. So next we're going to be treating the frontalis. So I'll get you to raise your forehead.
But you can still.
What does the buzzer do? I've never had
Oh,
that.
it's more for distraction.
Oh, nice.
Yeah. Is it annoying? I
No,
just
So
Some
basically,
patients like it, some people.
so basically our pain sensation, it goes through a certain pathway in our spinal cord, and that's pinprick and pain. But vibrational sensation goes through a different pathway in our spinal cord, so it bypasses the pain pathway, so it tricks your mind to thinking
Okay,
you don't
that's
feel
really
pain.
cool. Yeah.
Let me know if ever it's
It's,
annoying, I'll stop.
If you ever wanted to Google it, it's called gate theory.
Okay. Okay.
Yeah.
I've had times where I didn't feel it as much.
This seems to be a blunt end, that's why you want like your first this one. So we're going to be doing now your crow's feet. So we're going to be doing the crow's feet now. So we'll start with lateral aspect. Want the eyebrow lift, right?
Sure.
Yep. Okay. So we're going to be right under the brow here. So we'll do the other side. So we have about 10 units here. Doing great.
Oh, this is not even the worst part. The way to make this off.
Well, this is to get trust in
Yeah.
you, right? Yeah, I actually like the sharper end, not the blunt. It glides faster, easier.
Oh, okay. Like, wait, you like this needle? Like, you like
this
this
needle
one?
is
Okay.
way much different.
Great. We have a lot.
Okay.
Awesome.
So normally it's 20, 20, 24. So I'll explain. So 20 for the lamellar complex, forehead 20, and then 24 for the crow's feet. I drew up 70, so you had a difference of 6. I used that. I was a little conservative on the forehead, like a few spots, but I used the rest to save you amount that we used for the eyebrow lift.
Okay.
Yeah, so it was a total of 70 units. So you should start to notice the effects of Botox in 3 to 5 days. I made a post on my Instagram on how to make Botox last longer. So one of the actual things that patients don't know about is that Botox actually requires a zinc molecule to take effect. So patients that are deficient in zinc may not have the effect of the Botox as well as if they did zinc supplements. So there's a supplement out there called Zytase. That's a combination of zinc and phytase. Phytase basically is added to improve the absorption of the zinc. So it'll be interesting once we get Zytase here to be using it for patients. It actually will be better for the patient, for the Botox will last longer. In terms of aftercare, the most common thing that you're going to experience is headaches. If you do experience headaches, you can take up to 1 gram of Tylenol every 6 hours. That's usually just the first day. Try not to be upside down. I don't know if you're gonna be up.
I'm not an acrobat version.
Yeah, or you know those for the back which they hang for their back, elongate their back. Yeah, so stay away from that. I do love that machine though. and no heavy exercise or movement in the first 24 hours.
Yeah.
And the results should last about 4 months, 4 to 6 months, depending on the patient. Some patients are faster metabolizers.
Can I take then just zinc supplement?
So, yes.
Okay.
So technically, yes, because zinc, phytase is only added to improve the absorption of zinc. So
Okay.
if you're taking a zinc supplement, it would help.
Okay.
And it will be interesting to hear because you've had multiple experiences with Botox. And sometimes you said that it didn't work for you. You mentioned to me.
Well, it left fast. Like with this point, I find it didn't last long. But then Xeomin lasted really, really long.
But she gave you almost a full
Yeah,
bucket.
yeah.
Okay.
And Botox has always worked depending on who injected it.
Do you ever have trouble sleeping? And another added advantage of zinc, it helps with sleep.
Okay.
Just, yeah.
So the first step was that I did get dental block, and you can see Dr. Shamout giving the injections here. This is basically for numbing so that the procedure is pain-free.
As well. Another technique you can use is you can do the cannula, but I find you have more control with the needle. So we're going to just to do basically up to 1.5 mils per quadrant. So we have 3 mils here, so we can use a half of it. So we'll start at the corner.
Do you feel anything?
A little bit.
Yeah.
You can feel so people get the misconception that when we freeze them, you're not going to feel anything. So freezing or with anesthesia, when we use lidocaine, local anesthesia, we actually block pain receptors, but it does not block sensation or touch.
Yeah.
So you can feel touch, but you should not feel pain. So are you in pain?
No, it burns a tiny bit. Is that normal?
Yes.
Okay.
It would burn like a lot if you weren't numb.
And we're going to just go into the lip, just to make sure we get more hyaluronidases in there. Your lip's gonna feel swollen for the next 24 to 48 hours. That's normal. And we'll go to the other side.
The initial swelling typically after 12 hours is like really diminished. Yeah.
You're working from home.
You didn't think that you actually had filler done. I told your sister I was dissolving a filler. I thought she would be happy. I thought she would be happy about that. And I'm like, oh man, am I breaking patient doctor?
You just don't know the difference at this point with
So like just leave it.
Okay, so again we're doing now the bottom lip. And up to 1.5 per quadrant cc's. And I'm really focusing on the cutaneous lip and then into the vermilion because that's really where the filler migration is. And I'm doing an anterior grade and retrograde injection as I'm coming out and as I'm going in.
That was so quick.
Not that bad.
Honestly, besides the first one, I didn't
You're
feel
so
much.
swollen.
It's amazing. Yeah, you're just putting some pressure for the little point bleeding.
Mm-hmm.
You might be speaking a little bit funny for the
Yeah.
next hour or two, but then as you go to the dentist, you know. And as Jasmine mentioned, she's right. Most of the swelling that you're gonna have now will diminish over the next 12 hours. But just like what we did with the fillers, using cold compress helps.
Okay.
And
Is it gonna be more than this?
No.
No.
I'll just tell someone it was meant to look like this.
But as you know, like with me, I always have an open door policy, and any patient can contact me through my Instagram if they ever have issues. I would never leave a patient by themselves without any questions being fulfilled. because that's not really my goal. I'm there to help, and it's important for me to know your updates to your status. Any questions you may have, I'm happy to answer. So it's like having a cosmetic dermatologist on call for you.
Okay. So the cold compress, how often and for how long?
You can do it every 15 minutes, as needed. There's no limit. It's not like you can't overdose on cold compress.
Really?
We're gonna send you home.
Okay. Should I also book for the temple?
I think you should do them together if you plan to.
Okay.
And I want to be conservative. I don't want to overfill your temples. You're quite young.
Yeah.
But just enough to get the effect with the lift.
Sure.
But it's good that we see the lift effect that we did from the Botox.
Yeah.
And then by that point, we actually will probably need less filler than if we just did the filler for the eyebrow lift. So it's a combination.
All right. Sounds good.
Yay.
Yay. I was expecting worse. It's really like not that bad. Yeah. Okay, thank you. Hi guys, I am back. I am in my car. I look crazy, obviously, but honestly, I was expecting worse. Like, there's no bruising, it's just very swollen, and I'm talking a bit lopsided because it got them here, but not on this side. So yeah, this is my lips. And I will show you guys as the swelling goes down, and stay tuned for the big reveal of no fillers. Hi, you missed mommy. Mais oui. Okay, it's okay. Just my lips are just swollen. That's it. I love you so much. Look at this face. Okay. So I am back home. I'm gonna show you guys how the lips look. I can already feel the numbing go away, but it's quite minimum pain. It's just more uncomfortable. So here you go, and I will keep you posted as they go down. Hi. Qu'est-ce qu'il y a, ma chérie? Hi. I love you. Mais oui, I love you. Cece has not stopped giving me kisses. Can we just all agree that dogs are the best? Okay guys, I am coming to you with super quick updates. Don't mind the mess in the back. It's just some scarves in my bag on my bed. But in general, I find that I find that the filler is going down super fast. What's making it look weird when I talk is the numbing. Like, I find that the numbing is taking a lot of time. But basically, my bottom lip, sorry, because I'm looking at myself in the camera too to make sure it's focused. But my bottom lip, I feel like it's almost gone, unless it, yeah. And then the top lip is still a bit swollen, and I can feel it when I touch. But really what is taking time and a bit more uncomfortable is really the numbing. Because although it's going down, the pain is definitely increasing just a little bit. It's like getting lip filler, but it is definitely sore. And yeah, it's numb also, like on my nose here, on my chin. So I'm looking more forward for that to go away than the swelling. I will show you guys another close-up. Here we can see that this side is starting to be a little lower than that side. And the bottom lip is just chilling. know it's early. Oh. So as you can tell from Cece, who is still asleep, I have just woken up. I was gonna say we, but not we. I am awake, and I'm gonna give you guys a lip update. Please don't laugh at my pajamas. It does have handbags and shoes on them. So here is what my lips look like. To be quite honest, I don't feel any more product, but I feel like the upper lip is bigger than the lower lip, which feels weird. And also I still feel a bit like numb, if that makes sense. Like I find the movement in my mouth is a bit off, so I guess it's gonna improve still, because it hasn't even been 24 hours. It's gonna improve over the course of the day, and I will keep you guys posted. Hi everyone, so we are at the 24-hour mark, and these are my lips, just with a little bit of lipstick. And I'm not gonna lie, I don't hate it. I was really nervous about the procedure, which was a lot less painful, a lot less difficult to go through than I thought. And I was really wondering actually how I would react to seeing my lips with no filler. And it's quite interesting because as much as I love the field of cosmetics, and I mean I even worked in a medical aesthetics clinic because I loved it so much, I do think that sometimes I encounter two types of reaction. I do have a lot of criticism of people saying, you know, why are you doing this? You're so young, like you're against natural beauty, you're fake. And I don't agree with that approach. However, I've also seen the other side where people are like, just do you, like if you like it, do it. And even doctors encouraging that to a point where it can be a very slippery slope, and you might go too far in one direction, because you have to remember at the end of the day it's a business. So I love Dr. Shamout because he was the first one to say, actually I think you need to dissolve. Like you might, if you want to keep going forward with fillers, I think you need to take a step back to take 2 steps forward. And a lot of people that are more in the positive mindset of, oh, like, yeah, do it for yourself if you like it, sometimes won't tell you when you go too far because they're profiting from it or it's benefiting them in the moment. And I've definitely, over the years, think I had blindly trusted doctors because they're doctors. So there's a certain status that goes with that. And I'm finding that it is more and more challenging to find a doctor that also very much cares and that will really tailor a solution for you according to your needs. And that's exactly what Dr. Shamout does, and it took a while to find him, but now he's my doctor and I'm only gonna go to him for injections. And I had asked other people before, hey, is it migrating? Like there's this white line that I thought was normal, and some people actually told me like, no, your lips look great, just leave it, like you're lucky that it didn't dissolve and you don't have to get filler anymore. And you know, no one told me about the risks or the fact that you're adding over old product. They're just looking to treat you, right? So those are my thoughts, and I am going back next week to refill them a little bit. I don't think they will be as big as what I had, because what I had again was since 2017 and I kept adding. So I'm not sure how much was in my lips, but I must have reached at least 2 or 3 mLs because I never dissolved. So there's always some sort of residue, so you're always adding over that, so the volume keeps increasing. So now there's nothing, and I'm gonna put I think 1 ml, so we'll see how it is. I do have a very I don't have like non-existing lips, but I do have a very like flat and long mouth. So I do like putting filler in the middle to give more like of a round shape and elongate my face a little bit more and make my chin less prominent. So I think that that is the game plan for next week, and I will again take you guys along with me and keep you posted.